We begin with some good news. Amid the COVID-19 pandemic, both hospitals in Texarkana could begin vaccinating their frontline workers as early as next week. Our Simone is live at Christus St. Michael Health System with more this evening. Sydney.
FDA is in the final stages of approving Pfizer's COVID-19 vaccine. If everything goes as planned, vaccines could be shipped out across Texas to 109 hospitals later this week.
Once the first round of Pfizer's coronavirus vaccines are approved, Christus St. Michael Hospital and Watley Regional Medical Center will each receive 975 doses of the vaccine for frontline healthcare workers.
The thought is that you can get your healthcare workers immunized, that keeps them kind of healthy and safe so they can take care of COVID-19 patients.
Many have been wondering, will this vaccine be required? Medical professionals say the answer to this question is no.
We are strongly recommending for our associates to get it, but we are realizing that it's an individual decision. For some folks, it's just an easy yes, and for some people, they need to talk with their families or with their primary care provider to figure out if this vaccine is right for them.
Pharmacy Director Stacey Wise recommends waiting to get the vaccine if you've already contracted COVID-19.
They're not saying not to get it, but they don't have to because they already have the antibodies. And since that's what the vaccine is supposed to do, there's really not a reason for them to get it in the first wave.
Those who choose to take it are required to get the second dose 21 to 28 days later.
The reason for that is that you get the first dose and you want to give people kind of like a smaller dose, making sure that their system starts to build up the immunity, and then give them a second dose, which then kind of bolsters or boosts up that first response. Not every vaccine is like that.
Dr. Robinson says the only way to break the long history of mistrust in the government when it comes to vaccines is to do your research.
But I think the only way to get around that is to arm ourselves with information. This is a vaccine from a trusted vaccine company that makes a lot of the other vaccines that we give to children and adults.
Medical professionals say the vaccination for the general public won't be available until the spring. The goal is to have everybody vaccinated by summer of 2021, and as of right now, pregnant women and children under the age of 16 cannot take the vaccination. Reporting live in Texarkana, Texas, I'm Simone, NBC6 News.
Sydney, thanks.